Hi, everyone. Gary Brahms here with the National Kidney Foundation. It's my pleasure to welcome you to another edition of the National Kidney Foundation's Facebook Live series. Today we'll be discussing why and how you should protect yourself from the flu during COVID-19. I'm happy to be joined by Dr. Sally Ann Coleman King. Dr. King's a physician and an officer in the United States Public Health Service working at the Centers for Disease Control and Prevention and the Influenza Response Team. And we're also joined today by Dr. Joseph Vassalotti. Dr. Vassalotti is the Chief Medical Officer at the National Kidney Foundation and a clinical professor of nephrology at the Icahn School of Medicine in Mount Sinai Hospital. I'll remind you that if you have questions on the subject, please post them in the comments section. We'll do our best to answer as many as we can as we get through. So Dr. King, thank you very much for joining us today. And I want to start with you. I just want to ask you kind of to set the stage here a little bit and describe why it's more important now to get the vaccine for the flu these days in the midst of a global pandemic.
Yeah, thank you for having me. And you're exactly right. We think that there's really never been a more important time to get a flu vaccination. Each year, the flu causes millions of illnesses, hundreds and thousands of hospitalizations, and tens of thousands of deaths. And while we don't really know this year what the flu season is going to look like, we do expect that SARS-CoV-2, the virus that causes COVID-19, to be circulating with the flu this fall. And we do believe that it's possible that people may become infected with both viruses. So we're really hopeful that we will have a COVID-19 vaccine soon, but right now we do have a flu vaccine. So it's incredibly important for folks to really consider getting the flu vaccination this year, more important than any other year. We're working really hard to get the word out, especially to people with chronic kidney disease and others who are at high risk for complications from the flu. And this is an incredibly important year for them to work towards getting flu vaccine. Having the flu shot would go a long way towards protecting them from the flu.
Right, and protecting the healthcare system overall, right? Can you describe that a little bit and the importance of that?
Yeah, so you're exactly right. We are concerned that with the flu coming this fall and with COVID-19 continuing to cause illnesses and hospitalizations, that our hospitals are sometimes at capacity. And as you mentioned, not only will getting the flu vaccine protect you and your family, it also protects the community and the healthcare system, because once you get the flu, even under good circumstances where you don't have complications and you're not hospitalized, you still often require a medical visit and sometimes testing, and those types of visits and supplies take away from our capacity to really try to help care for everyone who needs help from the COVID-19.
Yeah, thanks for talking about that. So you just mentioned testing. What types of testing is available?
So there's several types of flu tests out there. One that we often hear about, we call the rapid test, and it's the rapid influenza diagnostic test. It takes about 10 to 15 minutes to get a result, and it looks at pieces of the virus, what we call antigens from the virus. The test is really quick, but it's not foolproof, and you may have a negative test and still have the flu, unfortunately. We also have a rapid molecular test that looks at genetic material from the virus. It's only performed in some labs, so it's not as easily accessible. And it does perform a little bit better, but again, you may still have the flu, even if your test is negative. If your healthcare professional believes that you have the flu, they may decide to go ahead and start you on antiviral medicines without getting a flu test. Or maybe sometimes even before the flu test, even if you get one, before it comes back. This may be especially true in those with chronic kidney disease because they have a higher risk of complications. It may also happen if they just have a really high suspicion or they really believe this is the flu that you have. They may go ahead and prescribe some antiviral medications. It's important if they're going to prescribe them. We believe they work best soon after symptoms start, within the first couple of days after your symptoms start. So sometimes that clock kind of speeds things up.
Yeah. Okay.
The antiviral medicines can help reduce the time that you're sick. So they can also sometimes help with reducing your risk of being hospitalized or having complications.
Cool. All right, thank you. Dr. Vassalotti, thanks so much for being with us. And I kind of want to switch gears a little bit here. And the fact that we are the National Kidney Foundation and we're on the National Kidney Foundation Facebook page, can you describe a little bit of, sort of the importance of flu vaccination in kidney disease and the importance of keeping kidney patients healthy during COVID-19?
Sure. Well, it's great to be here. It's great to work with Dr. King here and to partner with the CDC to help inform you about the importance of the flu shot. It's so important if you have kidney disease. You probably heard that people with kidney disease are at increased risk for severe COVID-19, for hospitalization from COVID-19. And similarly, people with kidney disease are at increased risk for severe influenza or flu.
Mm-hmm.
And so all people with kidney disease, whether you have chronic kidney disease at any stage, if you're treated with dialysis, whether you're home or in a clinic, or if you have a kidney transplant and you're taking immunosuppressive drugs to prevent rejection of the kidney, it's important to have a flu shot. And the shot actually does not contain any active virus or live virus. So it's safe for people with kidney disease. There are few reasons not to take a flu shot that we can get into later, but in general, everyone with kidney disease should have a flu shot. And I love the fall here in the Northeast with the changing of the leaves, and it's a good time to remind yourself that now is the time to get a flu shot. Right now, October is often recommended as the peak time because it takes about 2 weeks for the flu shot to provide you with protection or immunity. And the flu season typically starts around this time and doesn't peak until, in most years, December through February, something like that. So you want to protect yourself now, so when the flu is out in the community, you'll be safe.
Okay, so for people with kidney disease, are there specific types of vaccines that you recommend?
Well, that's a big topic, but I would say specific to respiratory illnesses, I think it's important for everyone with kidney disease to have the flu shot, but the other shots to consider are the pneumonia shots. And there are 2 different types of vaccines for pneumonia, and there's a sequence with which they need to be given. And I think it's really important to talk to your clinician when you receive the flu vaccine about whether or not and how you can have the pneumococcal vaccine or the pneumonia shot as well.
Okay.
So the flu shot is protects you from the flu, which is a virus, and the pneumonia shot it protects you from pneumococcus, which is a bacteria. So it's a different type of infection.
Okay. Well, you stole one of my questions for Dr. King, which was when people should get the vaccine. It sounds like they should get it now, really, as early as
Now
possible.
is great.
Okay.
Yeah, so just as he said, it takes a few weeks for your body to respond and to build up those fighter cells to really protect you. And the real magic answer is you should get your vaccination at least 2 weeks before flu begins to circulate wherever you live. So just as he said, we usually say October is fantastic because it gives you a little bit of time usually before flu is circulating. But that's the important thing, and it's hard to have that foresight. So having your vaccine before you need it is not necessarily a bad thing. So don't wait until your friends get the flu. Go ahead and get your flu vaccine now. And just as Dr. Vassalotti said, the flu vaccine should be given anytime while flu is circulating. And so that extends into the spring, sometimes as late as May, we can see flu circulating. So, if you have family members who are not able to get vaccinated right now, please do still encourage them to get vaccinated in the fall, and even if it begins into next year.
Right. Okay. And where should people go to get the vaccine now?
Yeah, so you can go many places to get the vaccine. If you're having trouble or you want some guidance on where you may find vaccine for the flu or for any other vaccines, there's something called vaccinefinder.org. So VACCINE vaccine, and then the word finder, FINDER.org. And I'm sure we can post it. But vaccinefinder.org they partner with over 34,000 different sites, and those sites update their vaccine availability so that you know before you go whether they're going to have vaccine or not. So what you do is you go online, you select the type of vaccine that you're looking for, and then you put in your zip code, and it'll map it and give you a nice list that shows you the closest spots to your home, so that you can select wherever you'd like to go.
Great.
Yeah, and I wanted to add that one thing we didn't mention is that for age 65 and older, you should receive a high dose shot. So there's a regular dose and a high dose. So if you're over 65 years, if you have a kidney transplant, or you're on dialysis, or you have chronic kidney disease without those treatments, you should get the high dose vaccine if you're 65 or older. And one of the nice things I noticed about the vaccine finder that was just mentioned is that you can click 65 plus, and you'll find out about the influenza vaccines in your area that are available, that are high dose. I think the vaccine finder is great. You can also call your pharmacy that's nearby to schedule it. See if your health insurance will cover your vaccination. Often it's covers without a copay. There may be ways in your community that you can access free influenza vaccination if you have no health insurance or limited health insurance. And of course, work with your clinicians to be vaccinated if you can't find local availability for the shot.
Okay, thank you. I'm looking at the clock here, and I want to get a chance to give the folks that are watching a chance to ask some questions of you guys. So let's do that now. This is where we put you on the spot. So I'll just remind the folks that are watching that if you have questions on this subject, you can post them in the comments section. We're going to do our best to answer as many as we can. In the event that we do run out of time, just know that all the questions will be addressed at some point here in the coming days on the National Kidney Foundation's Facebook page. So let's see, here's the first question is from Kevin. Kevin says, I just received the flu shot. Will there be any problems with getting a COVID vaccine when that comes out, which hopefully is soon? Are there any problem mixing those two vaccines? Who wants to take that one?
I'm happy to take the first stab. We are still waiting to see what the COVID vaccines look like. They do vary in the type of method that they're using. What we do believe at this point is that having your flu vaccination should not impact your ability to get your COVID vaccination. At this point in time, I spoke with some of our team recently, and they even believe that there may be the possibility of having those vaccines at the same time. So we're still studying it, but we are optimistic that we may be able to get the vaccine at the same time, should it become available soon. And in the meantime, please do get your flu vaccination, because it absolutely will not impact your ability to get the COVID vaccination. One important thing to remember is that if you have your flu vaccination now, then you won't have the flu when COVID comes. So maybe that will actually help you get the COVID vaccine and not be sick from the flu.
Right, great point.
Yeah, and I would just add that these are two different viruses. We can't see them; they're invisible, but they're two different things. And if you're waiting and anticipation, or you're looking forward to the coronavirus vaccine or for COVID-19, don't let that stop you from getting a flu shot now. Those are two separate things. And the flu shot, if anything, will help prepare you better for a future vaccine for COVID-19, or what we call SARS-CoV-2 is a virus.
Gotcha. Thank you very much. This one is a little more kidney focused. Dr. Vassalotti, Patrick is asking he's on now, it looks like he's on his second kidney transplant. His first transplant lasted about 20 years, and this new kidney about a year. And he's asking, according to nephrologists, the COVID-19 vaccine is not for transplant patients. Is that true?
Well, I think we have to learn more about the vaccine that in the future. This is kind of hitting a moving target, and so he's asking a question, will the COVID-19 coronavirus vaccine be safe if I'm immunosuppressed and I'm a kidney transplant recipient? And I think my answer would be, I'm not sure. I hope that it's going to be like the flu shot, which is inactivated, which can't make you sick. So if it's like that, then certainly it may be safe. If it's not, if it's like a live attenuated vaccine, like the intranasal flu vaccine, which we only recommend for healthy people under age 50, which is absolutely not recommended for people with kidney disease. If it's more like that, it might be that we would say to you that your household contacts might be better served to get that vaccine. So I think we have to sort this out and learn more about what the vaccine is and about its safety and about the population that it's been studied in to really inform you more. And I want to congratulate you on getting the gift of life twice. Fantastic. And and of course, please get a flu shot. And right now, and I think we'll deal with this decision about whether it's safe and how to take the coronavirus vaccine later when it's available. And that's a decision we're looking forward to having to address.
Yeah. Talking about, is it safe? We were talking earlier before we went on about some of the stories that are going on around there about, that it gives you the flu, that the flu vaccine will actually give you the flu and you can get sick from this. When do you guys want to address that?
Sure. Yeah. So flu vaccine, it can actually cause the flu. I know that people talk about that a lot. But the flu shots are currently made in two ways. Either, as Dr. Vassilotti was saying, you can have a flu virus that has been inactivated or killed, and that is used to make the flu vaccine. Or you just have a single protein from the flu virus, as opposed to the whole thing. And that's used to produce what we call an immune response. So to make your body respond to it and make those fighter cells, those antibodies. The live vaccine, the nasal spray does contain live virus, but it's been what we call attenuated. That means it's been weakened. It's still not recommended for those with chronic kidney disease, but it is an option for other people. We recommend that everyone over the age of 6 months of age get a flu shot. So, there are options for many different people, but it's really important that you talk to your clinical professional about which one is best for you.
Okay, thank you.
I want to say one other thing, and thank you, Dr. King, for raising that, is household contact. So just because you received the flu shot as a patient or person living with kidney disease, make sure your household contacts do the same, because that will give you an additional protection. And of course, you can potentially become infected with influenza or flu from a household contact if they're not vaccinated. So please think about that.
Okay.
That brings me to one other thing. And, we do have people, sorry, we do have people who feel like they got the flu from their flu vaccine. I get it. I've had it happen to me before. What that is either you have been exposed to a flu virus that's not covered in the vaccine. So there are lots of flu viruses. People in the medical world look at what flu viruses are going around the world and pick the most common ones, and those are the ones that are put in the vaccine. So they pick the ones that are the most likely to make you sick, but it doesn't mean there aren't others that are kind of traipsing around the world. So you may have been exposed to a virus that wasn't covered by the flu vaccine. You may have a cold, or you may have unfortunately been exposed before your antibodies, your fighter cells, were ready to fight the virus. So just like Dr. Vassilotti said earlier, it takes a couple of weeks for your body to build up that immune response. And so as your body is building that, if you're exposed during that window period, you could get sick. So that's why we talk about getting the flu vaccination before the flu is being seen in your community.
Yeah, there's a little bit of luck involved, I guess, there.
Well, good planning.
Yeah.
Good planning.
But well said. Thank you. Here's another question from Mindy. This one says, if you get the flu shot now, will it still be effective next February and later? I think maybe she means by next February, by this coming February. Like, how long does this last?
Yeah, I mean, I think it's variable. I think generally we would recommend that you get the shot now, if it's available. It's hard. There may be some differences in how durable or how long the protection lasts, but I think that many people that protection will continue, and I think the specifics probably depend on you and your immune system and whether you're immunosuppressed or not, and other factors.
Okay. This looks like a two-part question, and this one's from Susan. This one says, how is COVID affecting transplant patients versus others? So why don't we start with that one first? How is it affecting transplant patients versus other patients?
Well, I guess I'll take that. I would just say that there was some speculation that kidney transplant recipients, because they're immune suppressed, might have less of a robust reaction to the virus, and that might actually be protective in a way, because that reaction might cause some of the lung damage or some of the tissue damage. That doesn't seem to be the case, and so most of the series that have been published so far have shown that kidney transplant recipients are at least as at risk as others for hospitalization and for complications, for requiring mechanical ventilation or other interventions for severe COVID-19.
So the second part of the question was, and this is a toughie, if schools go back in person before there's a vaccine, is it safe for me to send my daughter?
That is a toughie.
Yeah.
It's about the interventions or the things that they're implementing in schools, the community spread, levels of community spread. When we think about COVID-19 as the SARS-CoV-2 is the virus that causes COVID-19, there are a lot of things that need to be in place in order to make sure that our communities are safe before they go to school. So it's a personal decision, and based on your level of risk, your daughter's school, level of how they have prepared the school and the students, and the community transmission that's going on. Dr. Fascioletti, do you have something to add to that?
Yeah, the only thing I think that was great, what Dr. King said, that have situational awareness. Right? What is going on in your community with the coronavirus? What does it look like? Is it spreading? Is it growing? Is it looking like it's reducing in severity? And also, I think it's a really good question. You have to think about, does your school age child put you at risk because they might bring back an infection? So I think it's an important thing for you to think about. I think it's great for you to talk with your clinicians about this to give you more individualized expertise and feedback. And I think also I would say that this is a great reason for your school age child to get the flu vaccine with their pediatrician, and for you, of course, to get the flu vaccine. So at least we can take flu out of the equation, right? We can reduce the risk of influenza, and then we'll focus on the risk of COVID-19 accordingly.
One of the things we were talking about earlier also is something called intranasal flu vaccine. And somebody's asking, can you help us understand what that means? And ultimately, if family members could or should get the intranasal flu vaccine.
So, okay, I guess I can start. So I think we heard Dr. King talk about that live attenuated vaccine. So that has live virus. It's weakened, as she said, or attenuated. So it's less likely to cause infection, but it still potentially can. So it's generally recommended for people who are young. So like the school-age child could potentially be offered that we heard about in the last question. I think it's okay for the healthy child to have the intranasal vaccine, but it's not something that someone with kidney disease should ever have. And the other thing is that if you have a kidney transplant and you have household members who are getting that live attenuated vaccine, you may want to talk to your doctor, because there might be some risk to you for a very brief period of time. And that risk is probably small, but I think it's worth at least understanding and considering.
Here's a question from Dan. This one says, should transplant patients get meningitis shots?
I think so. I would have to look that up. I think, to be honest with you, but there's a whole list of vaccines for transplant recipients that are safe to receive, and then in general, some of the live attenuated ones. So the ones that are weakened but live are the ones that should be avoided for kidney transplant recipients. So that's something to talk with your transplant care team about to understand. And then you could go through the whole host of vaccines. And I saw some questions about the shingles vaccine. So that's one that in the past was live attenuated. So it was actually contraindicated for transplant recipients. But now the modern one that's widely available, that is like the flu shot. It has no live virus, and so that cannot cause an infection. So the modern one is safe to use. So I think it's important to have these conversations with your transplant care team.
Yeah, very good. Thank you. Here's another question. Anonymous person is asking, are people with one kidney more vulnerable to COVID?
Yeah, we get a lot of questions about this. I think it depends if you have other risk conditions. You know, people can be born with one kidney. About 1 in every 200, 500 people is born with one kidney. You can be healthy and donate a kidney to someone else, or you could have a kidney removed because of a tumor or some other reason. So the reason for having one kidney is important to know. And then, do you have kidney disease on top of that, or do you have lung disease or diabetes or another risk condition for severe COVID-19? So I think that that would drive your risk. Your individual situation and the other comorbidities we say are other risk conditions you might have.
Yeah. So I have a question, because earlier you had mentioned the two different vaccines for people that are over 65, under 65. Can you talk about that a little bit and what the difference is?
Well, this year they call it it's quadrivalent this year. Both of them are called quadrivalent, so it's really like kind of 4 strains, I guess, would be the way we would explain it, of the virus. So both the regular dose and the high dose cover these 4 strains of the virus. So it's more potent, and it depends on the year, and Dr. King may know this better than I. There's more antigen, or there's more of that that substance that your body develops immunity to that protects you. So there's more antigen or material for your body to react to in the high dose for people age 65 and older. Dr. King, you might be able to.
That's the terminology is high dose and low dose. Is that it?
A regular dose, I think.
Regular dose. Okay, very good. Thank you. Let's see, we've got time for 1 or 2 more questions here. This one says from Tracy, I've had 3 kidney transplants since the age of 24. I'm now 47, and in March I got COVID and thought it went away 2 weeks later. I got it a second time. Now I have absolutely no energy, no appetite, a couple other factors. My doctors diagnosed me with chronic fatigue syndrome. Is that something that you're seeing in a lot of kidney transplant patients? I don't know if you can answer that, but that's the question. Dr. Basilati, you have any thoughts on that one?
Well, there's a lot to unpack there in that question, but I'm so glad that you got 3 kidney transplants. That's great to hear. There are long-term effects, I think, of COVID-19 that are playing out in different ways, and certainly chronic fatigue is one of the things that has been observed. I think I'll just leave it at that. I think you should work with your clinicians about how, what can be done to help improve your energy level. And I know that can be very wrenching and difficult to deal with. So, I wish you well, and I encourage you to work with your clinicians to find solutions.
Yeah, these types of things are tough because there are so many variables involved, right? That I think at a certain point you really do need to just talk to your clinician and work through them. Everybody's different, and there's no magic bullet, as they say. Here's, let's see, one final question. This one says, not vaccine related, but I am being told by my consultant I will need dialysis. Not sure when my GFR is 10, but I still need to lose 15 kilograms in weight. Can I still go swimming being on dialysis?
So I think that really doesn't have anything to do with the influenza, but I think you should get a flu shot. So, you know, because you have advanced kidney disease, then you will be going on dialysis, and that may expose you to different health situations where you may be potentially exposed to influenza. So please get a flu shot. I think the honest thing I would say to that is that when you start dialysis, your quality of life probably will be reduced, at least in the beginning. And depending on the kind of dialysis you do, I think you can have a different kind of a normal, a new normal, and hopefully will get you as close to where you are now when you're on dialysis in the future. But I think that's really important for you to talk with your clinicians about that, what you want, what your expectations are, so they can help deliver you to that point where you can continue to be as active as you are. And being physically active is a great, important part, and it's a great element of health. So I commend you for that.
Yeah, thank you very much. So unfortunately, it looks like we're run out of time here. I just want to remind everybody that in case we didn't get around to asking your questions today, please do check back on the National Kidney Foundation's Facebook page. We will be posting the answers to all of these questions in the coming day or two. I'll remind you also that both the NKF website and the CBC website both have a ton of information available on this topic, easily searchable. So I recommend that you go there and check those pages out. I'd also like to thank Dr. King and Dr. Vassalotti for joining us today and helping us make sense of what I know can be a very difficult and confusing subject. So thank you so much, guys. I really do appreciate it. And now, on behalf of the National Kidney Foundation and the CBC, I'd like to wish you all good health.
Thank you. Sleeves up. Get your flu shot.